All right, great. Great, excellent. So welcome everybody. Thank you so much for joining. My name is Kelsey Brown and I'm part of the North Shore Division of Family Practice team. I help out with the Pathways administration. And tonight we're going to be going over some topics that help benefit MOAs in their day-to-day responsibilities. We are going to be going over how to search and filter specialties, how to email items to patients securely, and how to utilize and access your favorites list. And I'd like to begin by acknowledging that the land I'm joining from is the traditional unceded territory of the Musqueam, Squamish, and Tsleil-Waututh nations, where I'm lucky enough to live, work, and play. And just a few quick housekeeping items before we get started as well. If you have any questions, please feel free to pop them into the chat and we will do our best to get to them all throughout or by the end of the session here. And we are recording the session. And for our attendance records, please just make sure that your first and last name is visible so we can ensure you receive the Uber Eats gift card. And so moving over to my slides here. So for our new Pathways users, what is Pathways? Pathways is an online resource that provides physicians and their office staff teams quick access to current and accurate referral information, including wait times and areas of practice, areas of expertise of specialists and specialty clinics. Pathways can also provide access to hundreds of patient and clinician resources, as well as community services and allied health information that is categorized and searchable. Pathways' philosophy is to improve patient care. It is built by family physicians for family physicians. We want to have a local sense of ownership with Pathways. And Pathways is also password protected. It is only to be used by physicians, their medical staff, and authorized healthcare providers. It is not a public-facing website. Pathways' goals is to provide accurate referral resources, thus facilitating optimal and efficient specialist and clinic referral decisions, to provide up-to-date evidence-based physician and patient care resources, and to be a repository for shared care work, and to act as a communications tool. So we're gonna, what is the benefits of using Pathways? Pathways helps to identify the most appropriate specialist for a patient's needs with the shortest wait time. It provides a single access point to locate specialist clinic contact details, patient instructions, and referral forms, and provides access to patient resources that can be emailed directly to patients. So we're going to go over how to search and filter the specialties, emailing resources to patients, and how to edit your favorites list. And so just going to switch over to Pathways here. And go. All right. So
we're still on the PowerPoint, Kelsey.
Oh, am I?
There you go. There you go.
Oh, there. Okay, great. Thanks so much. Perfect. So right now we are in the medical user view. So this is how it's going to appear for all of medical users. And when you log in, you're going to land on the home page. And we have the provincial updates always listed at this top banner here. So right now there's the new surgical pre-op optimization care pathway. And this will be updated regularly with the provincial updates. So great place to keep an eye out for those. And then below that, we have the latest specialist and clinic updates. So any new specialists or family physicians who have joined the area, or clinics that have made some changes to their practice, or have either started or begun accepting referrals. So it's a great place to check for new physicians in the community, and great way to get some leads for some new referrals, where to send them. And then below that, you get into the news updates as well. So they have the invite right now to the informational webinar for the referrals hosted by Doctors of BC. This is for physicians, but it is a great place to check for upcoming webinars that are available to MOAs and to staff. The Pathways does have an annual webinar, so I do highly recommend trying to join that if you can, once they host it. I believe it'll be in January. And so below that, we've got the GP Link. For those of you who are not familiar, GP Link is the resource for attachment for patients who are looking for a family physician. So if you have any patients needing attachment, looking for a family doctor, please encourage them to use GP Link. And they just need to go to ns.searchdoctors.ca, and that will take them to the GP Link where they can apply, and just ask them for some of their information through a survey. To do this, they do need to be a resident of North Vancouver, West Vancouver, or Bowen Island, and not already be attached to a family doctor or a nurse practitioner in the community. And they must also have active or pending MSP coverage as well. So that is a GP Link, and then as they go ahead, it will lead them into the survey. And then once they complete the survey, that is sent to our GP Link coordinator, Katie Tang, who will put them on a wait list, and they will be matched with a physician. And then just down below, we've got an update for access for CT scans in the Lower Mainland. Here's the link from the previous Pathways webinar from January. And we have some PCN updates as well from our PCN pharmacists. And their information down here is at the bottom. So for any of the clinics who are connected with one of the PCN pharmacists, you can find their information here. And they also each have their own profile page as well. And then at the bottom of the news items, there is an archive of past news items and the Pathways Pearls newsletter. So you can check out the latest edition from May and previous copies, previous versions as well. And this column here on the side, this is the updated featured content. So there's a few different categories. There's like clinician tools and patient information and forms and community directories. So anytime a new resource has been added or updated, we try to highlight that here so you can see there is a new version of that form, or there is a new form for a particular referral or a particular clinic. I can see here the ADHD adult self-reference symptom scale was recently updated. So if you wanted to view and collect the most updated copy of that, you can just go right to it from here. It will take you to the resource. And it is a fillable resource, so the patients are able to fill them in and then select. And it can be printed, and we'll show you how, we'll get to how you can send this directly to the patient and add these particular forms into your favorites list as well. We'll get to that in just a moment. And just going back up to the top here. So right here, you do have a few options along the top. And we're going to start with the drop down here for the specialties. So dropping down, you see here in this first box, we have all of the consultative specialties. And then below it, we have the community and health authorities services. So the top part here, this is the medical directory. This is the only physicians and the staff are able to view this information. The community and health authority services is a public-facing portion. There is a public-facing portion of this website as well. So if your patients did want to look into some particular community and health authority services that may not require a medical referral from their doctor, they can go here. And to do that, you just go to pathwaysbc.ca/community, and it will take you to the divisions listings. And go to North Shore. And this way, they have a view of this, and they can access all of the different resources. And so just going to go back, because we're going to be focusing on the medical portion of the directory, but this is a great resource for the patients as well. And so back up here, we are looking at the different specialties for referrals from our doctors. And so let's begin with a common referral scenario. Let's say your physician had a visit with one of the patients and they suspect the patient has glaucoma, and they've asked you to find an ophthalmologist who will see this patient for glaucoma. So we're going to go to the ophthalmology specialty. And so it's going to land us here showing a list down of all the ophthalmologists. And there are a few other tabs here along the top. It will always land you on the consultants page, but you can toggle over to view the clinics and pooled intakes, physicians for advice, community and health authority services, and clinician tools, some patient information handouts. The blepharitis is a pretty common condition, so that might be one that you would find handy and you could favorite that. And we'll go over the favorites list a bit more as well in a bit, but that is something you can take a look for through these tabs, pearls of information and forms as well. We're going to go back to the consultants tab because we are looking for a particular ophthalmologist who will see a patient for glaucoma. And so the next thing I would take a look at is by clicking this show details button, it's going to drop down and give us more details about what the physicians see or do not see, or what they're most interested in. And as you go down, you can see some have it, not all of them do, but we do try to put in as much information as we can capture from the specialists. And then the next column here, they have, as you see, if you just toggle your cursor over it, you can see it's accepting for consultative referrals. So he is currently accepting pathways e-referrals. This one here is accepting pathways e-referrals and also sending pathways e-referrals. So as you go down, you can see there are some different icons. This particular one is for telehealth services. And over here on the side, this is the icon key legend. So you can see all of the different options and what they mean, or you can also just toggle over as you go. But just going back up to the top here, you can filter, so you can filter by what they are accepting for. The next column here is for the average non-urgent wait time. And so again, you can toggle and you can filter this by clicking on it so that you're receiving the shortest time at the very top. And then it will show you the city as well, which is also, you can filter by city, but it doesn't quite keep the earliest one at the top once you do that. So I try to sometimes go by this one first and go and see, but it also depends on the referral and the patient sometimes as well. And so another great thing to look at here before continuing on is looking on this right-hand column where you can further filter for more specific referrals. And so in this case, we see glaucoma is an option here. So we're going to select that. And now the physicians it is showing me, they all will see referrals for glaucoma. And as we can see here, Dr. Stephen Ma, it's in one of his most interested areas of practice. And so he is accepting for referrals. He's got a 1 to 2 week average non-urgent wait time, and he works in Burnaby and Richmond. So maybe we want to find some more information about Dr. Stephen Ma. We'll click on his name to take us to his profile. And so we can see he does offer advice to healthcare providers via telephone and email. And he sees patients for these particular symptoms and syndromes. Along here, we also have his areas of practice and what he's most interested in. Glaucoma management is listed there. And there are some, what he does not see is children under the age of 6. And then you can see here, he does work at a location in Burnaby. So we could inquire with the patient if they're willing to go to Burnaby, because they would be seen probably sooner in that area than in North Vancouver. Or there's also the Richmond location as well. And it gives you all of the information, the phone number, the fax, and the clinical email. Keep in mind, some are for physician use only. They will list some of the profiles if it is for public use as well. And so as we get down, it also will give you some more information about how they accept referrals. So they accept it by fax. There is no particular referral form. If there was, it would be listed in this area and it will have a link so you can access it directly from the profile. And this one showing non-urgent wait time is 1 to 2 weeks. And the average length of time to notify the referring provider is within 1 week. They do not accept calls from patients after referral to book their own appointments. So something to note, because some will accept calls directly from the patients after the referral is sent. And that would be a good piece of information. Let the patients know so they can follow up and book an appointment as soon as possible. And he does accept urgent referrals. If it is considered an urgent referral, he would accept it by phone. And the patient instructions as well here. So it's great to list this information to the patient when you let them know about the referral, and the cancellation policy as well. And he has privileges at Mills Memorial Hospital. One thing I want to point out as well with the profiles, you can print or email the information on a particular specialist to the patient. It's giving us the option here to select a particular location. I'm going to select the Burnaby location. And then you can fill in the information for the patient, their appointment date and time, the instructions. It gives them the cancellation policy and even a map of where the office is. And you have the option down below here to print this, or you can email it directly to the patient. Please make sure you do have the patient's consent to send information from Pathways. And please note that neither the patient's email address nor the appointment details are stored in Pathways, nor will they be used again for any purpose. The email will only be sent to the patient, and it will be coming from a no reply at pathwaysbc.ca email, so it will not expose your email to the patient. Yes, and so that is a great way to share information to the patient. And then one more thing as well, if you say contacted this office and you were informed that their wait time is actually not 1 to 2 weeks, but it's looking more like 1 to 2 months now, and you were like, hey, this is not correct. We have this button just down at the bottom where you can let us know and provide us feedback if you find that there is some incorrect information that needs to be updated. And so we do really appreciate if you do come across anything, letting us know so we can contact them and update it to make sure it is accurate. So back to our specialties menu here as well. Just want to do another scenario. Probably one of the most common referral scenarios, dermatology. So going over to the dermatology tab here, and this is listing all of the dermatologists. There used to be some family physicians under this category who have a special interest in dermatology, and there's been a change in the way they are found or searchable here. So now, when you go to dermatology, we're looking at strictly dermatologist specialists. And so say we're looking for a dermatology referral for someone who has atopic dermatitis. And so we see here, the one in North Vancouver has got a 2 to 2.5 year wait list. It's a really long time. So maybe we'll look at someone as we go down, maybe someone here in Vancouver, if the patient's able to travel over to Vancouver to be seen. Maria O'Connor is a new dermatologist, and she has a 2 to 4 month wait time. She is currently accepting consultative referrals and offers telehealth services. So I would take a look at her, and if you feel like she would be a great option and they're able to travel to Vancouver, then you found a great option. But maybe the patient has some issues with travel and really would prefer to be seen on the North Shore. So in that case, I would ask your referring physician if they feel it could be directed to a family physician who has a special interest in dermatology. And if they feel like that will be a sufficient referral, what you would do is you would go back under the specialties, but you would search under family medicine. And here under family medicine, it is listing all of our family physicians listed on the North Shore and pathways, but we're going to go down to the filter side here, and we're going to go down to primary skin conditions. Primary skin conditions is also going to drop down further with some more options, and atopic dermatitis is a primary care skin condition that is listed. So we're going to select that. And now it's going to provide any family physicians who have a special interest in dermatology who will see patients for atopic dermatitis. And we see here, Dr. Farkab Budi, she is accepting patients for consultative referrals and offers telehealth services as well. She's got an average wait time of 1 to 2 weeks and is in North Vancouver. Looks like a pretty great option. So take a look at her profile here. And so she will see patients with primary skin conditions, atopic dermatitis. Doesn't have any limitations that would affect our referral. And so you can see here her office location, fax number, average wait time 1 to 2 weeks, and not a lot of special instructions for the patient and no specific referral form. So you could fax the general referral form. They also accept urgent referrals by email as well. And so they have a cancellation policy, $150 for no-show and 48 hours notice for cancellations. And this physician has hospital privileges at Lionsgate Hospital. So that is an option for searching for dermatology. If you're not finding anything that has a short enough wait time within the dermatology specialist, and it's something that the referring physician feels they could see a family physician with special interest in dermatology, I would recommend going that route. And just one more quick scenario before we move on to the rest of them, because I'm realizing we're getting to the end, getting close to the end here. So if you had a patient who was seen for diabetes and your referring physician is, okay, let's find a specialist for this patient who has got type 1 diabetes. So a great way you can also look into finding specialists for a particular concern or referral reason is by searching in the search bar here. It is going to give you a ton of options for diabetes. So we want to narrow this down. And at the top here, there are some more tabs. It gives you the different areas. We go to the consultants tab. It's going to ask us for what type of diabetes specifically are we referring for. And we're going to select adult type 1 and type 2 diabetes. And it is now going to present all of the physicians who will have a special interest and see patients with type 1 or type 2 diabetes. Dr. Dae-Won Lee, he is an endocrinologist, and he is accepting for consultative referrals, 2 to 4 week average wait time, and he's in North Vancouver. Excellent. So maybe the physician says, let's go ahead and refer to Dae-Won Lee. And in the meantime, can you find some information for diabetes education to send to the patient in the meantime? And there may be a particular form they're asking you to send, but if you search back to diabetes and you go to the patient info tab, it's going to give you a lot of great patient handouts regarding to diabetes care. This diabetes self-monitoring blood glucose interactive is a popular tool that they use. So say the doctor says, in the meantime, please send the patient the self-monitoring blood glucose interactive tool. And so by clicking on the resource, we now have the option, we can email this directly to the patient. And by clicking this, again, we want to make sure you always obtain consent from the patient that they consent to you sending them this information from Pathways. And then you will put in the patient's email address here. And there's a drop down that has a few preset messages. Here's the information you requested, or maybe this doctor says they want them to monitor their glucose and then follow up in 2 weeks. So book for follow-up in 2 weeks, and then they would present the log that they've taken after their, in their follow-up appointment. And so you will email the tool to the patient. Once you do that, it's giving you this message up top here. So it's just a quick blurb saying this, you have, they've provided their consent and you have sent them the following items and have advised to book for follow-up in 2 weeks. You can copy this just by copy to clipboard. And then instead of having to type this into the EMR or into the task, you can just copy and paste it right in there. So it's a quick little shortcut for documenting that. And one more thing in regards to that, into this tool, if it's something you feel like, oh, I'm probably going to use this again in the future, this is something that is helpful, you can favorite it. So I'd actually already had that on my favorites, but now we see, or it was not, sorry. So if the heart is black, it is not on your favorites list, but by clicking it, it's creating a red heart and is now on my favorites list. And so if you go up to your favorites list here, you can now see it's going to be in the patient form and clinician tools. And there it is, the diabetes self-monitoring blood glucose tool. And so that you can access right from your favorites page if you know it's something you've put there. So as you go, you can build it up for the content and the patient handouts and questionnaires that your physicians are asking you to send most often. And so those will be like the PHQ-9s and GAD-7 and the ADHD self-report symptom scale. So I try to have anything that I would use often and pop it in there. And then you can switch between, there's a clinician tools tab, the patient information tab, and the forms tab as well. And they're also have further specialty or further category for sorting for each of them as well. But you typically do put on the ones that you find favorite, and then they'll all come up here. The ones that you see down below here that are on the black hearts, those are Pathways favorites picks. So those will still remain here because they are some really commonly most used forms and resources, but you can favorite them so that they will pop up at the top for you. And then that way you have a way of keeping your favorites all at the top. And so I'm sorry, I just realized we're at 6:30 already, and I did go over most of everything that I had planned to share with you. I'm just curious if there is any questions or any questions. Excellent. Well, it looks like no questions popping up in the chat, and that means we're finishing right on time. So thank you everybody so much for joining, and I hope you found that helpful. Please reach out to me if you have any questions about Pathways, and if you're feeling like there may be something you could be doing to use it better, let me know and I'd be happy to reach out with you. Great. All right. Well, everybody go and enjoy.
Sorry, Cassie, I do have a question, but it's not for everyone, so people can leave if they want.
Sure, yeah, I can hold off and wait.
It's not like private or anything like that. It probably doesn't sort of impact a lot of people. So I'm not currently on Pathways. Am I able to register, I can just make myself an account on Pathways and then I can use it in the same way that the MOAs would use it in terms of if
Absolutely.
I'm covering or things like that.
Absolutely. I will send you your Pathways account. I will get you set up and then send that over, and it'll include the instructions on how to use your access key. But then, yeah, you should definitely have your own account so that you're utilizing it.
Okay, and do I have that indefinitely? Like say, yeah, like do I have it indefinitely or is it associated with a specific clinic?
It is, yes. So we are checking this. We check with each user every 6 months. So if somebody leaves, we do want to be notified that they have left, because it is only for the staff of physicians who are members. So if you no longer are working at the clinic where you were registered for your account, please let us know so we can look into either switching you over to the new clinic you're working at, or seeing what type of access we should be allowing you to have in there at that point if you're no longer associated with a clinic.
Okay, sounds good. Yeah, so it's similar to like Care Connect in that way in terms of the doctors that you're working with and things like that.
Exactly. Mm-hmm.
Okay, perfect. Thank you.
Great, excellent, thank you. Any other questions? All right, well, I thank you very much, everybody, for joining, and I hope you get out and enjoy some more of that sunshine this evening.
Thanks, Kelsey.
Thank you. All right, have a good night, everyone. Take care.